Well, as many people these days, this is my second career. My first career was in computer science, got a computer science degree from Purdue University, and I practiced for 12 years and in that field. There were some big changes, and thought my next shot should probably be healthcare of some sort. Like a lot of people, I thought, want to be a doctor. But then when I started asking around, I found out that a lot was going on with clinical pharmacy, that pharmacists were seeing patients, that pharmacists were making changes to medication regimens, making a difference out there. And when I heard that, I decided to go to pharmacy school at University of North Carolina, Chapel Hill. After graduation, I practiced in geriatrics for a while. For about a year, I did consultant pharmacy, and then I got offered a faculty position with Campbell University, and they were expanding into the Wilmington area, an exciting growth area with a lot of healthcare organizations, burgeoning, doing new and innovative things. I decided that seemed like a good role for me, and to teach fourth-year pharmacy students sort of on the job, interviewing patients, making a difference. Yeah, a lot of patients come to our service from a physician referral, and I'll say about 50% of them don't really know why they're there. But we kind of know why they're there. I've been doing this for about 8 years now with Wilmington Health. They're there because that's really one of the symptoms, is the fact that they don't know where they are with their disease state. They don't know what's happening with their medications. They don't know where to turn for help. And so the fact that they come in and they say, I don't know why I'm here, really tells me, where to begin, where the problem is, in explaining what disease they have, what the implications of that are, and how their medications, relate to treating that and keeping that under control. Yeah, so my visits are an hour long, and the reason why they're so long is because really try to deal with every aspect of the patient's difficulty with their medication, and that is they often come in without a fundamental understanding of the disease, of the medications, and we hope that they leave understanding why they're taking the medications, what those medications will prevent from happening, or how those medications will make them feel, how meds interact with other meds or interact with their diet. Really, we're hoping that they'll become much more empowered, much more engaged with their own health care. I often tell them, you have a doctor, but you are your main healthcare provider. You are the person taking care of your health as the patient. You're directing all of your care, and those of us that are professionals are here to help you with that as best we can. Well, I have 4 kids between the ages of 8 and 10, and so that keeps me busy. I have a lovely wife that we'll be celebrating our 2nd anniversary in just a few days. She keeps me entertained and keeps me engaged with a lot of things in life. Recently gotten into remote control type vehicles, so I'm using some of my engineering background in the form of a hobby. Of course, being in academia, there's research, conferences to go to, and I enjoy keeping up on the latest, both technology and the latest in healthcare. I try to read the news and try to use my education and my knowledge and my experience to interpret the medical news that's coming out, and not only for myself, but hopefully I'm able to do that for the patients when they come in as well.